Imagine your dog, usually bouncy and full of energy, is suddenly just, well, off. Maybe they're a bit more tired than usual, and you notice a subtle yellow tinge to their gums.
Yeah, or maybe their digestion just seems completely out of whack.
Exactly. It's a really worrying picture, isn't it? And that's kind of a glimpse into what can happen with something called extrahepatic bile duct obstruction, or EHBDO, in dogs and cats.
That's right. And in this deep dive, we're tackling EHBDO head-on. We're using detailed medical information as our guide here.
And our goal really is just to give you a clear understanding of what this condition is, why it's so serious,
Mm-hmm.
what signs to look out for, how vets diagnose it, and crucially, the vital steps in treatment.
Exactly. Think of it as getting the crucial information, without getting totally bogged down in medical jargon.
Okay, so let's start with the basics then.
Yeah.
What exactly is a bile duct obstruction in this context? What are we talking about?
Basically, it's a blockage. It's in the plumbing system that carries bile outside the liver. Now, bile, which is made in the liver, is absolutely crucial for digestion. And these blockages, they can happen in the main pipe, that's the common bile duct, or sometimes in the smaller ones feeding into it, the hepatic ducts.
Right.
The bottom line is the bile just can't flow properly into the intestines like it's supposed to.
Okay, so a blockage is the core issue.
Yeah.
But why is that?
Yeah.
Why is that so dangerous for the animal? What actually happens?
This is where things get serious and surprisingly quickly, within just a few weeks of a bile duct obstruction starting, a really damaging chain reaction kicks off.
A few weeks. Wow.
Yeah, waste products, toxic components of the bile itself, they start to build up. The pressure from all that backed up bile makes the ducts swell up.
Oh, dear.
And all of this leads to significant damage to the liver tissue itself. We're talking about a rapid slide towards, serious liver injury.
So this really isn't something that can wait. Those few weeks sound critical.
They really are. Intervention needs to happen fast.
Now, you mentioned something in the prep, white bile. That sounds really strange. What's the story there?
It is quite weird, isn't it? Normally, bile is, well, greenish. It's got pigments in it. But if the little side tube to the gallbladder, the cystic duct, also gets blocked, then a fresh, pigmented bile can't actually get into the gallbladder. So the bile that's already trapped in there can lose its color over time. It becomes this sort of colorless fluid we call white bile.
Ah.
So seeing white bile, say during surgery or diagnostics, is a definite red flag. It points to a specific type of blockage involving the gallbladder. And it also, frankly, raises our concern about potential bacterial infection. Stagnant bile is just much more prone to getting infected.
Infection as well. Goodness, that sounds like another major problem layered on top.
Absolutely. Bile flow itself is actually part of the body's defense system down there in the digestive tract. It helps flush out bacteria.
I didn't realize that.
Yeah, so when that flow stops because of a blockage, the risk of bacterial infection just skyrockets inside the bile ducts in the gallbladder. So the blockage doesn't just hurt the liver directly through pressure and toxins, it also weakens the body's ability to fight off infection right where the problem is.
Okay, so let me see if I've got the basics. We're looking at a blockage of the bile pipes outside the liver.
Right.
That stops the bile flow.
Mm-hmm.
Quickly leads to a buildup of harmful stuff, maybe this white bile if the gallbladder is involved, and a much higher risk of infection.
You got it.
And the system primarily affected is the hepatobiliary system, liver, gallbladder, bile ducts.
Precisely. Now let's shift gears a bit. Who is most likely to actually experience this? Are all dogs and cats equally at risk?
Yeah, that's the big question, isn't it? Are there certain types of pets, certain breeds maybe, we should be particularly watchful of?
Well, while EHBDO can happen in any dog or cat, some breeds definitely seem to have a higher predisposition.
Like who?
For instance, breeds that are already prone to pancreatitis or gallstones, think miniature schnauzers, Shetland sheepdogs, especially Shelties with high levels of fat in their blood, hyperlipidemia. That can increase their risk of something called gallbladder mucoceles, which can lead to obstruction.
Oh, okay. So if a breed is already sort of inclined towards pancreas or gallstone issues, that might pave the way for a bile duct problem too.
Exactly. It sets the stage, you could say. Then there are also breeds with a condition called ductal plate malformation, DPM. Sometimes it's called Caroli's malformation.
DBM. Okay.
This is basically where the bile ducts just don't develop quite normally from birth. It makes these animals more vulnerable to infections and also a gallstone formation within those abnormal ducts.
Gotcha.
And interestingly, just looking at gallstones specifically, they do seem to pop up more often in smaller breeds, in both dogs and cats.
Smaller breeds. Okay. What about the age of the animal? Does that matter? And males versus females.
Yeah, good question. For the EHBDO that develops over time, what we call acquired EHBDO, we tend to see it more often in middle-aged to older animals.
Makes sense.
But, younger animals can definitely be affected if they have one of those congenital conditions, like the DTM we just talked about.
Right, the birth defects.
Exactly. As for whether it affects males or females more, well, there doesn't really seem to be a significant sex predisposition. It hits both pretty equally.
Okay, so summary. Smaller breeds, generally older pets for the acquired kind, but younger ones if they have those congenital issues. No clear gender link.
Got it. Now, thinking about owners,
Mm.
if someone suspects their pet might have this, what are some of the sort of early warning signs they might notice at home?
Well, the signs can definitely vary. Depends a lot on the underlying cause, and how complete the blockage actually is.
Sure.
But some key things owners might pick up on include just a gradual increase in their pet's tiredness, lethargy, a general feeling that they're just not quite right.
Vague, yeah.
Very vague initially sometimes. With jaundice, that yellowing of the skin, the gums, the whites of the eyes, that's a really important sign. And it often gets progressively worse. You notice it more and more. And what about changes in their bathroom habits? Anything specific to look for there?
Yes, definitely. With a complete obstruction, you might actually see pale, almost white or clay-colored stools.
Ah, a colic stools.
Exactly, colic stools. It's because the bile pigments that normally color the feces aren't getting out.
Right.
Interestingly, and this sounds a bit counterintuitive, some animals with a complete blockage might actually have an increased appetite. Polyphagia.
Really? Increased appetite with a blockage? That seems odd.
It does, doesn't it? But it's likely because they're not absorbing fats properly. They need those bile acids for fat digestion.
Yep.
And if they aren't getting into the intestines...
The body signals need more food.
Kind of, yeah. Trying to compensate for the malabsorption, but as you asked, is it always there? No, not universally. It might be subtle or absent if the obstruction comes on super fast or if the animal just feels nauseous from everything else going on. But it's a recognized thing. Another really concerning sign, and this seems particularly true in cats, is developing increased bruising or bleeding more easily, sometimes within just 10 days or so of a complete obstruction.
10 days. Wow, that's quick for bleeding issues to show up.
It is. It relates to vitamin K absorption, which needs bile.
Okay, so those are things an owner might notice.
Yeah.
What about the vet? What might they find during a physical exam?
Again, it varies with the cause, but weight loss and obvious jaundice are pretty common findings. The vet might be able to feel an enlarged liver when they palpate the abdomen hepatomegaly,
Okay.
unless the obstruction has been there a long time and it's already led to scarring of the liver, biliary cirrhosis. In that case, the liver might actually feel small and firm. In smaller animals, sometimes the vet might even feel a sort of mass effect up in the cranial abdomen related to the swollen bile ducts or gallbladder. Some pets will just show vague signs of discomfort when that area is palpated.
Just generally sore up front.
Yeah, exactly. And going back to the stools, if there isn't any bleeding happening in the gut that's masking the color, those pale colic feces might be noted on exam too.
Right.
With chronic EHBDO, those bleeding tendencies we mentioned might also be evident little bruises, maybe?
Oh.
And finally, owners often mention their pet's urine looks darker, kind of an orange color. That's from high levels of bilirubin spilling into the urine.
So a real constellation of signs, potentially. Yellowing, stool color changes, lethargy, maybe that weird increased appetite, abdominal discomfort. Okay, but what are the actual underlying causes? Sounds like there could be quite a few things leading to this blockage.
You're absolutely right. There's a really wide range of primary issues that can end up causing EHBDO. We can sort of group them.
Okay.
One group is blockages happening inside the bile ducts themselves.
Right, like stones.
Exactly. Gallstones, cholelithiasis. Also inflammation of the bile ducts, that's cholelithiasis. And unfortunately, neoplasia tumors growing within the ducts themselves.
Okay, so internal blockages like stones, inflammation, tumors. What other types of problems?
Another category involves congenital issues, problems the animal is literally born with.
Like the DPM you mentioned.
Yes, like DPM or Crowley's malformation, but also things like choledochal cysts, which are these sort of fluid-filled sacs on the ducts. Polycystic hepatobiliary disease, where you get multiple cysts in the liver and the bile ducts. And in cats specifically, sometimes things called cystadenomas, which are growths that can press on the ducts where they exit the liver.
Wow, okay. So some animals are just dealt a tough hand from birth. What about things coming from outside the bile ducts? Can they squeeze them shut?
Yes, definitely. External compression is another really important cause category.
Like what?
This can happen if lymph nodes near the bile ducts get enlarged, maybe due to inflammation or cancer, and they just press on the ducts.
Okay.
Other types of tumors in nearby tissues can do the same thing. Pancreatitis inflammation of the pancreas is a big one. The pancreas sits right next to the common bile duct, so when it swells up,
It squishes the duct.
it can absolutely squish the duct closed. Sometimes the common bile duct can actually get trapped if an animal has a diaphragmatic hernia where abdominal organs slip into the chest.
Oh, wow.
And even, believe it or not, a foreign object that the animal swallowed, if it manages to get down to the small intestine, it could theoretically block the little valve where the bile duct enters, the sphincter of Oddi.
Goodness.
And don't forget parasites. In cats, liver flukes can physically obstruct the ducts. It's amazing how many different paths can lead to this one outcome.
It really is a huge list. And I see scarring and narrowing on our outline, too. How does that fit in?
Yeah, that refers to duct fibrosis and strictures. Fibrosis is basically scar tissue forming around or within the duct wall.
What causes that?
It can happen after trauma, like a blow to the abdomen, or from inflammation spreading from nearby tissues, like with peritonitis, which is inflammation of the abdominal lining, or severe pancreatitis. In cats, it can be part of inflammatory liver diseases like cholangitis. Duct strictures are more like actual narrowings or pinch points in the duct. These can also result from blunt trauma or sometimes as a complication after surgery in that area.
So it could be something growing inside, a birth defect, pressure from outside, parasites, or even scarring from a past injury or illness. It really underscores the complexity. Now, faced with all this, how does a vet actually diagnose EHBDO and try to pinpoint the specific cause?
Yeah, the diagnostic journey, it involves ruling things out because many conditions can present with similar signs, especially jaundice and lethargy.
Right, the differential diagnosis.
Exactly. So the first step is often thinking about those other possibilities. Could it be a different type of liver disease? An infection primarily affecting the liver? Is it just pancreatitis without a bile duct blockage? In cats, is it hepatic lipidosis, fatty liver? Or could it be a tumor somewhere else, like in the liver or gallbladder?
So it's not always immediately obvious it's EHBDO. What kind of lab tests are usually run first to help narrow things down?
Blood tests are absolutely essential. Standard procedure, really. A complete blood count, the CBC, might show anemia. Could be mild, could be worse if there's some hidden bleeding in the digestive tract.
Okay.
The white blood cell count gives clues, too. A high count might point towards an infection or significant inflammation. And importantly, when you spin the blood down, the plasma, the liquid part, will often look distinctly yellow, Eric.
Right, from the jaundice. And what about the blood chemistry panel? The liver enzymes, bilirubin, all that.
Yeah, the biochemistry profile is usually where we see really significant changes. Enzymes related to bile flow, specifically alkaline phosphatase, ALP, and gamma-glutamyl transfer, GGT, tend to be markedly increased, very high. They're sensitive indicators of bile duct issues.
Okay, ALP and GGT high. What else?
Enzymes that indicate liver cell damage, like ALT and AST, are also usually elevated, showing the liver itself is stressed or damaged. Total bilirubin levels will be high, often moderately to markedly high, confirming the jaundice clinically. Other things we look at. Albumin, a protein made by the liver. It might be normal initially, but can drop if the obstruction goes on for weeks and liver function declines.
Right.
Globulins, another protein type, might be normal or sometimes increased, maybe due to inflammation. Cholesterol levels are also commonly elevated in these cases, so the blood tests give us a really strong indication that there's a problem with bile flow and liver health.
What about urine tests? You mentioned the orange urine. Can urinalysis add more clues?
It can. We often find bilirubin actually in the urine bilirubinuria. That's a direct consequence of the high levels in the blood spilling over. Sometimes we might even see bilirubin crystals under the microscope.
Okay.
There's another substance, urobilinogen, that's sometimes checked in urine. Its absence can be linked to complete bile duct obstruction, but honestly, it's not considered a very reliable standalone indicator for EHBDO.
Got it. Are there any other specific lab tests that are particularly helpful here?
Measuring serum bile acids can be informative. They'll usually be markedly increased if bile flow is obstructed.
Right.
However, if the animal is already clearly jaundiced from a liver or bile duct problem, doing a bile acid test is often kind of redundant. We already know there's an issue.
Makes sense.
Blood clotting tests, though, can be really important. Coagulation profiles, they can show abnormalities pretty quickly, within maybe 10 days, due to that vitamin K deficiency we talked about. This seems especially common or severe in cats.
Okay, checking clotting is key then.
And finally, just looking at a fecal sample might reveal those pale, acolic stools, unless, as we said, there's some bleeding into the intestines that's making the stool look dark instead.
Okay, so blood work, urine tests give strong suspicion. But what about actually seeing the blockage? Imaging must be key.
Imaging is absolutely crucial. Regular x-rays, radiographs of the abdomen, they can sometimes show things. An enlarged liver shadow, maybe signs suggestive of pancreatitis, possibly mineralized gallstones if they're dense enough to show up, maybe a mass.
But limited, maybe?
Yeah, often limited for the ducts themselves. Ultrasound is generally a much, much more powerful tool for actually visualizing the bile ducts.
Right, ultrasound seems like the go-to. What exactly can it show us?
Ultrasound, ultrasonography, yeah, it's really a cornerstone diagnostic here.
Yeah.
Often within about 72 to 96 hours, so 3 to 4 days of a significant bile duct obstruction.
Okay.
We can actually see the bile ducts becoming dilated, stretched out. The common bile duct, the cystic duct going to the gallbladder, even the smaller ducts running within the liver tissue itself. They can look wider than normal, sometimes even kind of tortuous or twisty.
And can it show the cause?
It often can help identify the underlying cause, yes. We might see signs of pancreatitis, cysts, masses pushing on the ducts, or gallstones actually seating in the duct or gallbladder.
Great. Any pitfalls with ultrasound?
One thing to be careful about is mistaking normal gallbladder sludge, which can just be thicker bile in an animal that hasn't eaten for a while, for a true obstruction or stone.
Ah.
And in cats, their common bile duct can sometimes normally have a bit of a wavy or serpiginous appearance. So it's really critical to also look closely at the ducts inside the liver for dilation and to use Doppler ultrasound, the color flow feature, to make absolutely sure that the tubular things we're seeing are bile ducts and not blood vessels, which run nearby.
Got it. Doppler helps differentiate. So imaging gives us a great look, but sometimes maybe we need more direct methods.
Sometimes, yes. We might consider taking a sample of liver cells with a very fine needle hepatic aspiration cytology.
Okay.
That can be useful, say, for ruling out fatty liver in a cat, or maybe getting cells from a mass if we see one. However, and this is really important, we have to be extremely careful not to stick that needle directly into an obviously obstructed, swollen bile duct.
Why is that?
Because there's a high risk of causing bile to leak out into the abdomen. That leads to a really nasty complication called bile peritonitis. Very serious.
Right. Avoid puncturing the ducts.
Definitely. And for the same reason, taking a larger needle biopsy of the liver tissue itself is generally strongly contraindicated if we strongly suspect EHBO. The risk of bile leakage is just too high.
Okay, so biopsies are risky here. What about actual surgery? Is that ever part of the diagnosis itself?
Absolutely. In fact, surgical exploration of the abdomen, a laparotomy, is often the most definitive way to both diagnose and treat EHBO simultaneously.
Okay. Diagnosis and treatment in one go.
Exactly. By going in surgically, the vet gets to directly visualize the whole biliary system, the liver, the pancreas, surrounding organs. They can take proper tissue samples, biopsies for analysis. They can physically relieve the obstruction, remove whatever's blocking the flow stones, thicken bile, maybe even a mass if possible. And if the blockage is, say, due to scar tissue that can't just be removed, they might need to create a new pathway for bile to drain into the intestines. That's called a biliary enteric anastomosis. Sometimes a temporary stent might be placed too.
So surgery really allows for a full assessment and immediate action. Once they have a diagnosis, maybe from biopsy during surgery, what does the pathology looking at the tissues tell us?
Looking at the tissues, both what the surgeon sees with their own eyes, the gross findings, and then what the pathologist sees under the microscope gives us critical information.
Okay, what might they see grossly?
During surgery, the bile ducts and the gallbladder will often look obviously swollen, distended, stretched out. The cause of the blockage might be right there, a stone, a mass, severe pancreatic swelling. If the obstruction has been going on for more than a couple of weeks, the liver itself might look enlarged and have this sort of dark green or even mahogany color due to bile staining.
Right.
And in those cases where the cystic duct to the gallbladder has been blocked for a long time, that's when you might see that white bile we talked about earlier.
Gotcha. And under the microscope, what are the microscopic findings?
Microscopically, in the early stages, say the first week or two, we typically see the cells lining the bile ducts multiplying biliary epithelial hyperplasia. Little new bile ducts might start forming ductual proliferation. There might be debris, mucus, inflammatory cells within the ducts. And around the ducts, we often see swelling, edema, and the very beginnings of scar tissue formation, early fibrosis.
Okay, early changes. What about later on? Chronic obstruction.
If it's been going on longer, the changes become more severe. The cells lining the ducts can get damaged, eroded. You might see pus-like debris, suppurative inflammation within the ducts. The inflammation around the ducts becomes more mixed, involving different types of immune cells. The fibrosis, the scarring, becomes much more significant, potentially leading to cirrhosis eventually. And you can even see areas where the actual liver cells, the hepatocytes, have died off due to the backup pressure and toxicity. So pathology really maps out the damage over time.
It paints a detailed picture of the damage. Okay, so pathology confirms things. Now, let's get to the really crucial part. How is EHBDO actually treated?
Right, treatment. The cornerstone, the main approach for each BDO is generally hospitalization and surgical intervention. That's the primary treatment.
Surgery is key.
Usually, yes. The main exception might be if we have a very high degree of confidence that the obstruction is solely due to pancreatitis, and we think that pancreatitis might resolve with just supportive medical care, allowing the bile duct to reopen on its own.
Okay, so surgery, unless it's clearly just temporary pancreatitis swelling. What kind of supportive care do these animals need, especially around surgery?
Good supportive and nursing care is absolutely essential. This definitely includes intravenous fluids, IV fluids to keep them hydrated and support circulation. We often supplement with water-soluble vitamins, especially B vitamins, sometimes given IV as well. Antibiotics are usually started before surgery prophylactically to target potential bacteria in that stagnant bile.
Okay.
And as we discussed, if the obstruction has likely been present for more than about a week, or if clotting times are prolonged, we typically give vitamin K injections preoperatively to help prevent bleeding problems during and after surgery. Activity restriction is also important based on how stable they are.
And what about their diet, nutritional support?
Good question. We want to maintain their protein levels, provide enough calories, so we generally don't restrict protein unless there's a concurrent issue like severe liver failure, which is less common acutely.
Okay.
If there's evidence they're not absorbing fats, well, maybe those pale, greasy stools, then a low-fat diet might be recommended, at least temporarily. Supplementing fat-soluble vitamins is important because their absorption relies on bile. Vitamins E and K are particularly critical.
Right.
We need to be a bit cautious with vitamins A and D as they can be overdosed. In chronic cases where fat malabsorption might persist even after surgery, sometimes a special water-soluble form of vitamin E, like TPGS, is needed for better absorption.
Okay, targeted nutrition is important. It sounds like a really comprehensive approach to get them stable and support them. What kind of things do owners need to understand about this whole process? What's the key client education?
It's really vital to communicate clearly with the owners. They need to understand that, generally, surgery to relieve the obstruction is necessary. Unless we have that strong suspicion of resolving pancreatitis or maybe a tiny stone we think might pass, which is risky to wait for.
Okay, surgery is usually the plan.
Yes, and they need to grasp the urgency that EHBDO can lead to irreversible liver scarring, biliary cirrhosis, within about 6 weeks if it's left untreated. Again, maybe a bit longer time frame if it's pancreatitis related, which might resolve sooner.
6 weeks. That's not long at all for permanent damage.
No, it isn't. We also need to be really honest and upfront about the fact that surgical success isn't guaranteed. It depends on many factors: what exactly is causing the blockage, what the liver biopsy shows, is there a severe infection, what's the overall health and stability of the pet going into surgery.
Right, managing expectations.
Exactly. It can be a risky surgery with potential complications.
Speaking of the surgery itself, what are some key considerations for the surgical team during the operation?
Well, during the surgery, a thorough exploration of the abdomen is crucial. They need to identify the exact cause and location of the obstruction, unless, again, they're already very sure it's just pancreatitis.
Okay.
The surgeon's goal is to remove the obstruction, get the stones out, flush out thick bile or debris, resect a mass, if feasible, and confirm that the common bile duct is now open and patent, allowing bile to flow. If the gallbladder itself is severely diseased, like in a mucocele, it might need to be removed entirely, a cholecystectomy.
Right.
Now, if the obstruction can't be cleared directly, maybe due to extensive scarring or an unresectable tumor, the surgeon might have to perform one of those bypass procedures, the biliary enteric anastomosis, creating a new connection between the biliary system and the intestine.
And those have risks.
Yes. Owners need to know these bypasses carry risks, particularly a higher chance of ascending infection traveling up from the intestine into the bile ducts long term. Stents can sometimes be used, but they also have issues like potentially migrating, getting blocked, or causing inflammation, especially in cats.
Okay. What else does the team need to watch for during surgery?
They need to be hypervigilant for potential drops in blood pressure, hypotension, and heart rate bradycardia. Manipulating the biliary tract can sometimes trigger a vagal nerve reflex causing this.
Ah, the vasovagal reflex.
Exactly. So they need emergency drugs like atropine-ready, good anesthetic monitoring, respiratory support. Excellent IV access and fluid support are critical. They also need to anticipate potential bleeding and ideally have blood products available for transfusion if needed. And vitally, always collect samples, biopsy samples of the liver, maybe lymph nodes or masses, and a sample of the bile itself for culture and microscopic examination. That information is invaluable.
Sounds like a high-stakes procedure requiring a very prepared team. Let's talk medications. What role do specific drugs play in managing EHBDO?
Medications are definitely an important part of the supportive care package. Vitamin K1, as we mentioned, is often given preoperatively and maybe for a few days post-op to support clotting. In very rare cases of ongoing, unresolvable obstruction, maybe long-term vitamin K1 is needed, but we have to watch closely for side effects, particularly a type of anemia in cats if oversupplemented.
Okay, vitamin K is key. What else?
Vitamin E, especially that water-soluble TPGS form, can be beneficial as an antioxidant, particularly in chronic cases. Broad-spectrum antibiotics started before surgery are crucial to manage or prevent infection.
Right, antibiotics.
Other antioxidants like adenosylmethionine are often used too, as they can help support liver cell health and function.
Okay. What about ursodeoxycholic acid? I hear that mentioned with liver issues.
Yes, UDCA or URSO. It can be beneficial, but the timing is absolutely critical. It must only be given after the bile duct obstruction has been surgically relieved.
Why is that?
Because UDCA is a choleretic, it actually stimulates bile flow. If you give it when there's still a complete blockage, you're just increasing the pressure behind the dam, potentially making the liver damage worse.
Ah, okay, crucial point. Only after decompression.
Absolutely. But once flow is restored, UDCA can help make the bile less toxic, potentially reduce inflammation, and maybe even have some anti-scarring effects.
Got it. Any other meds?
Sometimes things might be given to help clear out the bowels before surgery, potentially reducing the absorption of bacterial toxins from the gut, though the evidence for this is debated. And if the pet can take oral meds and there's concern about stomach irritation or bleeding, gastrointestinal protectants like sucralfate or acid reducers might be used.
Okay, so summing up medication cautions.
Mm.
Never give urso before decompression. Be careful with drug doses for anything cleared by the liver bile. Watch out for vitamin K side effects with chronic use.
Precisely. And always be ready for bleeding and those vasovagal issues during surgery. And get those samples to the lab. Biopsies, bile culture essential.
Absolutely. So after surgery, what does the recovery and follow-up care look like? How are they monitored?
Postoperative monitoring is intense initially. We'll be tracking their bilirubin levels closely. If the surgery successfully relieved the obstruction, bilirubin should start to decrease relatively quickly, often within days.
Okay.
Liver enzymes like ALT and ALP tend to come down much more gradually, sometimes taking weeks or even months to normalize, if they ever fully do. If there were signs of severe infection, sepsis beforehand, we might repeat CBCs every couple of days at first.
And watching for complications.
Definitely. We need to watch very closely for any signs of bile leakage into the abdomen, bile peritonitis. That might show up as increased abdominal fluid, pain, fever, or just the animal not recovering as expected.
Right. What about digestion long term?
Depending on the underlying cause and the surgery performed, especially if the pancreas was involved or a bypass was done, some animals might need digestive enzyme supplements long term. We also monitor for steatorrhea, those greasy stools indicating ongoing fat malabsorption. If that persists after the jaundice resolves, a permanently lower fat diet might be needed, maybe with those enzyme supplements. Though, side note, enzyme powders can sometimes cause mouth irritation, especially in cats.
Good to know. Now, we touched on risks, but what are the specific potential complications people should be aware of?
Unfortunately, several serious complications are possible. Bile peritonitis from leakage is a major one. The bile duct can sometimes narrow down again after surgery, restenosis, especially if there was a lot of inflammation. If a bypass and anastomosis was created, that new opening can also scar down and narrow stenosis.
Okay.
Significant bleeding either during surgery or afterwards is a risk. Sepsis, overwhelming infection, can occur. That unresponsive low blood pressure during surgery or the vasovagal reflex can be life-threatening if not managed quickly.
That's a sobering list. It really highlights the seriousness. So pulling it all together, what's the overall expected course and prognosis for animals with EHBDO? Does it vary?
It varies hugely. The prognosis really truly hinges on the underlying cause of the obstruction.
Okay.
If it's caused by pancreatitis that fully resolves with medical or surgical management, the outlook can actually be quite good. Bile flow might return to normal.
That's good news.
However, it's important for owners to know that even after successful decompression, the bile ducts might still look somewhat dilated on follow-up ultrasounds. That doesn't necessarily mean it's blocked again, just that some stretching might be permanent, and some degree of permanent scarring around the ducts can occur
What
regardless.
about other causes?
If the cause is more serious, like an aggressive tumor or severe chronic inflammation leading to extensive scarring, the prognosis is naturally much more guarded. And in cats, we always have to keep in mind a condition called sclerosing cholangitis. It can mimic EHBDO clinically and on ultrasound, but it's primarily an inflammatory disease within the ducts and liver, and it typically doesn't respond well to surgical decompression alone. A liver biopsy is absolutely crucial to differentiate this in cats.
So biopsy is key, especially in cats. The outlook really depends.
It really does, case by case.
Well, this has been an incredibly thorough deep dive into a really complex medical issue. Thank you. To wrap things up, what would you say is the single most important takeaway for our listeners from all this?
I think the key thing to remember really is that extrahepatic bile duct obstruction is a serious condition. It generally requires prompt diagnosis and, very often surgical intervention is needed. Recognizing those early signs we talked about and understanding that there are many potential causes is absolutely vital for giving our pets the best possible chance of a good outcome.
It's truly remarkable, isn't it, how many different things can trigger this one critical blockage, and then the cascade of effects throughout the body when that essential bile flow stops.
Absolutely. It really hammers home how interconnected everything is inside the body. What might seem like a very localized problem, just a blocked tube, can have these really widespread, significant physiological consequences.
Yeah.
It kind of makes you wonder, doesn't it, what other seemingly simple blockages or disruptions, maybe elsewhere in the body, might also trigger unexpectedly far-reaching effects that we don't always immediately appreciate. Something to think about.